Tips and tricks. So we're going to talk here about pain on the elbow, inside or outside. Now I just want to let you know that this is your elbow at the back, all right? It's called dual crown and it's a hinge joint, it goes up and down. This is actually an articulation point for the muscles that work your hand and work your wrist, okay, forwards and backwards. So if you've got a problem here, okay, you have inflamed it from bad wrist movements, okay? Now, technically that would be, historically from the names golfers and tennis elbow, would normally be a jerky motion this way whilst the grip is closed, okay? So we're talking a club. Sometimes it hits a divot and then the elbow keeps going. Sometimes that we're talking we're in the air and we're hitting some sort of backhand and we're going and it's caught off guard. Maybe the ball hits further into the frame, creates more leverage and suddenly jerks our elbow along, okay? So here now we've got this pulls, it yanks, it inflames, you get pain, okay? So we're sore. It is the most achy, boring pain that you've ever had. It feels horrible. It's a bit like a toothache. Guys, if you're getting it, I know how that feels. Okay, we work with our hands occasionally. It's definitely an occupational trait. So there are a number of different things you can do, okay? But the principal thing that a lot of people forget is because it's down, the injury is down to poor alignment of your wrist or your fingers, okay? We've got to look into that for the client. So where are you doing it? Okay. Now this could be, I'm pouring a kettle. Okay. Wrist is malplaced. Okay. For the guys that come in and they're working machinery, you're drilling. Okay. You need to get that elbow behind the wrist. Okay. No creasing in it. Okay. Like that, no good. Okay, like that, no good. Now, you might find, for instance, someone using a vibration technology, all right, some sort of jackhammer, motorized jackhammer kind of thing, and you got the hand bent like this. You're gonna either create or, not propagate your healing. You're gonna damage the area, and if you keep doing that and compounding your healing for too long, and somewhere between about 8 and 10 weeks, we cut down, not us actually, the physiology from the body cuts down blood flow to these common entheses or tendons, and that means that you're not going to heal, okay, or your potential for healing is going to reduce from that point, okay? So we don't want you to get to the point where you come in and you've got chronic tendinopathy. Now when people do, we're a great clinic for that because we've got some wonderful treatments. One of them is focused shockwave therapy that works great. And if you want to know about that, check out our website. There might be some videos on here on the channel that you can also check out, give you some more information. But I'm going to give you a free bit of advice. One is about the positioning. You're going to watch out for that. You're going to look out for creasing of your skin, okay? Creasing of the skin at the elbow during any activity is going to be bad, okay? Now, particularly we see a lot of typists, people that are using mouse and things like that. So I want you to watch out for that, guys, because I don't want you coming in and not having addressed that. Now, the other thing is this bad boy, all right? So this is known as a Doc Zac Handmaster Plus, okay? This is the easiest version, okay? Now, because the root cause of the problem, yes, is in the wrist alignment, but the wrist alignment just causes extra stress onto these muscles and these tendons that go into the fingers. So I want to rehabilitate someone, whether that be for prepping them for focused shockwave therapy or getting them just conservatively managed. We need to make sure that the muscles on this side of the hand and wrist and the things that close the grip are all sufficiently worked. And then on this side, the same thing. Now, there is a technique called eccentric rehabilitation that's been proven to be exceptionally good for tendinopathies. We want to make sure that we're getting the eccentric loading into that area so you can cheat and hack your way out of this pain, So what we're going to do is we're going to make sure the wrist is straight. Okay. Now, if you've been to really good hand therapist, a physical therapist, and they've talked to you about this, then I want you to let you know what that means. And that kind of means that you're doing this and there's no creasing of the skin this way around. That would be wrong, for instance. That would be wrong, or this would be wrong, or this would be wrong, okay? So we're wanting to keep that centralized, closing, all right, and then opening, and trying not to deviate that wrist forwards and backwards throughout the phase of the fingers closing and opening. Now, yes, later on we can kind of enhance it. We can close and then we can bend the wrist, and we can make sure we do that evenly. We're not going to bend the wrist off to the left or off to the right, but we're going to start. This is really hard for clients. They find it incredibly hard to keep their wrist straight, but just close their fingers. So, and of course, those clients have issues, and so we know that they're sort of the compounding issue. So, going to keep it straight, open, and then crucially close. All right. Now, what I want to do is just show you what this hand looks like here. Okay. It's cupped. It's got an arch in it. Okay. Now, I don't know whether you've watched my videos, and I'll see if I can do them on how to do a press up. Okay. And if you don't know how to do a press up, this might be important for you. But, just like the arches of your feet, when we're powerful, we have an arch in our hand. Okay. What we see a lot of clients doing when they come in for follow-ups of their rehabilitation, they're going here and then they're collapsing down and flattening that whole hand. All right, don't do that. All right, you're not powerful there. You're not strong. You're taking these fingers into the end ranges of their range of motion, and we're susceptible there. All right, this isn't a good thing to train the brain to do, and so you shouldn't do it. Okay, so now get yourself one of these. They come in few different colors. Okay, I'd say if you're in a lot of pain, you need the blue. If you're not in a lot of pain, you can go for red, or you can go for orange. Okay, there's a few other things on some rehabilitation sites that you might want to look at that strap around the wrist and do one side and then the other. The reason I like this is because it does both in one tool. This is one thing to lose, not two things to lose, and I tend to find clients are more committed because of that. All right, easy to do means a better you.